Hello everyone and welcome back to the channel. Today we're going to be talking about diabetes, the latest research that is coming out about diabetes, just how fast it's growing, a few different studies that have come out talking about different causes of diabetes that I think you should definitely be aware about. And today's video is going to be a little bit different, so you're not going to be seeing me face to face, but I've got a whole slideshow for you today to talk about just what is coming out in medical research about diabetes. And to start it off, I thought that this picture was very interesting, and I think it's more true than anything else. But when we see all of these fast food chains, what we can say is that fast food is a huge reason for why diabetes is becoming rampant. And so you get free diabetes with a purchase of a large Coke at McDonald's. So to dive into this, what we're going to be talking about initially is blood test levels that indicate diabetes and prediabetes, because I think that these are very important for you to know to discuss with your doctor about. So as you can see down at the bottom, what we're looking at is normal for an A1C, which is your 3-month average of your blood sugars, is about 5. And then once you start creeping up to that 5.7 to that 6.4 range, that indicates pre-diabetes. And if you're not going for a regular checkup with your doctor or getting at least blood tests for this once a year, you're doing yourself a disservice, especially if you know that you're eating an unhealthy diet. And because a lot of this stuff can be prevented, we see a lot of neuropathy patients here at the office, and all of them wish that they would have done something sooner. And not only does it cause neuropathy, but there are a myriad of other symptoms that it causes, which we're going to be going over later. But with this, once that A1C hits 6.5, then that is how you are diagnosed with diabetes. And it's very important that it doesn't reach that point, because you start getting damage to the brain, you start getting damage to the nervous system once that occurs. When you look at fasting plasma glucose, so typically when you go get blood work at your doctor, you should be doing it fasting, because that can just talk about how good your glucose and blood glucose levels are doing. And normal, it should be around 99 or below. I like to see it around 80 to 85 when you have a fasting blood glucose, because that indicates to me that you are very healthy. Once we start creeping up from there, I start to get a little bit more concerned, because they have all of these ranges that indicate that you have pathology, but what about before you have that pathology? What's going on? Are we creeping up? What's going on with your diet? Is there another underlying factor? These are all very important questions to ask when we're talking about your health. So pre-diabetes with a fasting plasma glucose is 100 to 125. And if you have diabetes, 126 or above fasting indicates that you do indeed have diabetes. Normal with an oral glucose tolerance test, which is another test that your practitioner can do as well in order to determine if you have diabetes, is that if it stays around 139 or below, then you don't have diabetes. If we start to creep up into that 140 to 199 range, pre-diabetic. 200 above indicates that you are indeed diabetic. So all of these can really indicate if you are on your way to diabetes, if you're pre-diabetic, or if you are becoming diabetic. And so let's understand why this is such a critical issue in today's society. Now, this is an older study, and I have a more updated one that we're going to look at next, but this is the age it got out of hand. So in 1994, obesity and diabetes were relatively the same. So we were looking at, around the 4.5 to 5.9 range for the percent of the population diagnosed with both. And now if we zoom into 2010, you can see that it's over 9% of the population is now either obese or, in obesity, it's greater than 26% of the population. With diabetes, it's greater than 9% of the population. And with diabetic neuropathy, we see that causing about 30% of our patients. And this is very concerning, especially because some of these diabetics end up losing their feet. And who wants to do that, right? If you're going to retire and play golf, you definitely need your feet. So this is a more recent model. And in this, we're looking at, this is the latest update from the CDC. So in 2004, you can see that we were around that 1.5 to around the 8.4. There were a few places that were higher, but relatively diabetes wasn't very far widespread, and it wasn't affecting a huge percentage of the population. But now when we're in 2016, we see that anywhere between 12 to 33% of some states is being affected more so than others. And for me, this is very alarming, because this means that, one, I'm going to have to start seeing more patients, and I'm having to really work more in order to educate people, because something just is in the water, or people just don't understand just how severe this is. So down below, it's saying that 1.5 million new cases of diabetes, or 7 out of 1,000 people, are being diagnosed. And that's ages 18 and older. That is not including anything below that age range. And so even in kids, I think now we're seeing it popping up more and more. Now, when we talk about why this is occurring and why we talk about insulin resistance is so important, it's the actions of insulin when it comes to adipose tissue help it uptake glucose, and it actually creates more fat. So if you are getting fatter, or if you are putting on more fat tissue, then a lot of this is because insulin is pushing this glucose into the fat cells. Because if you have too much blood sugar, what happens is it's going to be created as fat. Lipogenesis is what that means. And this actually decreases lipolysis, which is the burning of fat. So the higher your blood sugars are, and the more your pancreas is having to secrete insulin, because it is a hormone, then what that means is that you're going to make more fat and you're not going to burn as much. Now, in striated muscle, it will increase the uptake and increase glycogen synthesis, which is energy, and protein synthesis. So does it have some beneficial roles? Of course, but it's not going to make you stronger. It's going to end up making you fatter. There is a threshold when it comes to this. And in your liver, fatty liver is a big issue, because most of the time, if you have diabetes and you have it for an extended period of time, it significantly increases your chances of developing fatty liver. And with this, it decreases gluconeogenesis, or taking the glucose from the fat cells and putting them into blood sugar. This is where fasting becomes very relevant and can really have a major impact on your blood glucose levels. And it increases glycogen synthesis and lipogenesis, or the production of fat again. So this is how the liver becomes fatty. When we look at type 1 and type 2 diabetes, we see that type 1 is sudden. It can occur at any age, but mostly young. These patients are typically thin or normal. Ketoacidosis is very common in these patients. They have an autoimmune issue, which is what this is saying with the autoantibodies. Endogenous insulin, so they can't produce their own insulin because their pancreas is shot and being attacked by antibodies. And identical twins, about 50% of them have it. So is there some genetic component? This is technically what that is saying. Prevalent, it's not as prevalent as type 2s, but type 2 is very gradual. A lot of the times this correlates to lifestyle issues. It's mostly in adults. Obesity is a high correlation, as we saw from the recent studies from the CDC dating back to 1994. Ketoacidosis is very rare. Autoantibodies, this is not caused by an autoimmune condition or genetics. This is 100% lifestyle. And endogenous insulin is normal or decreased most of the time because of the damage done to the pancreas and the insulin sensitivity going down. There's a 90% in identical twins, which is very interesting, which means that this really isn't more so genetic. It is more in accordance to your lifestyle. And what we see is that these twins grow up in a similar lifestyle, and they're taught the same dietary habits and lifestyle choices, which ends up leading to them developing diabetes. So, like it says here, it's more prevalent than type 1 and 90 to 95 of US diabetics. Here are some complications of diabetes. In the microvascular, so that means the big vessels, you're looking at cerebrovascular disease. This is TIAs, a cerebrovascular accident, or cognitive impairment. What are they calling Alzheimer's now? This type 3 diabetes. So this is why this is so important, because if you have a genetic preponderance to developing Alzheimer's, if you're developing diabetes or you have abnormal blood sugars, this is going to cause it to become even more prevalent. The next is heart and coronary artery disease. A lot of people think that heart disease is caused by cholesterol. Well, this is showing, a lot of the studies now are coming out that sugar is the main issue and cholesterol is just the innocent bystander there to patch up all the inflammation that sugar is causing in the heart. This can lead to coronary syndrome, myocardial infarction, or heart attack and congestive heart failure. So if you have swelling around your ankles, you better be careful, because that can either indicate heart failure or kidney issues. So be very aware of that. In the extremities, you see peripheral vascular disease. This can look like ulcerations, gangrene, amputation. This is what we deal with in the office, is that we find that it's affecting the peripheral vascular more than it is the actual nerves. And when those nerves don't get oxygen and nutrients because of lack of blood flow, this is what happens. In the microvascular, or the small vessels, you get retinopathy, cataracts, and glaucoma. How many people have cataracts? I know of at least 5 right off my hand that have cataracts, or they have some sort of visual impairment. In the kidney, this can lead to nephropathy, microalbuminemia, which just means that you have proteins in your urine. That's the same thing below. And then kidney failure. So if you're in chronic kidney disease, if you're in any stage of that, look at your sugars. That can be a huge reason why you're having these issues. And then what we work with here are the nerves, the neuropathy, the peripheral, and the autonomic. Especially if you're having metabolic issues, you've got to look at the autonomic system. Now, this is a pretty interesting fact. It shows that cancers to be doubled by the presence of type 2 diabetes. So some of the biggest issues that we're dealing with today, heart disease being the number 1 killer, cancers being in the top 3, and then blood sugar issues and brain issues, cognitive issues being another one. We see that diabetes can be the root cause of all of these, and if we can educate people and help them understand that the more sugar you consume, the higher likelihood you are to develop any of these chronic diseases goes up dramatically. So a smaller increased risk of 20 to 50% is seen for colorectal, bladder, breast, and blood cancers. This is pretty significant if you ask me. A 20 to 50% increase risk of developing these cancers. And this was a study done in the UK. And so I've got the link down there below, or if you want me to send it over to you, just comment in the links below and I can definitely get that reference for you. And then also this study is showing that if you are diabetic, you have 2 to 3 times the risk of dementia. So forgetting who you are, not necessarily Alzheimer's disease, but this includes any type of cognitive impairment. And then here are some potential mediators of cognitive impairment in patients with type 2 diabetes. Look at all of these. There's genetic predisposition, cerebral microvascular disease, dyslipidemia, HPA axis dysregulation, depression, inflammatory mediators, amyloid deposition, hypertension. How many people here have heart disease or have high blood pressure? I think almost every person that walks into our office has high blood pressure. And a lot of that goes to many different factors, but blood sugars is one of them. But it really comes down to poor nutrition and... Okay, sorry about that. So in my pyramid, this is what they consider a healthy diet. And a lot of this is based around these sugary, refined carbohydrates that just isn't correct. Of course, they have the vegetables in here. This is good. The meats are in good proportion, some fruit. Cut out all this dairy and milk and vegetable oils that they have in here because they're killing you. And I see a lot of people who come out of the hospital and they're diabetic. They weren't diabetic going in, but after they come out, they are. And this is because this is what they're serving you. They're serving you this orange juice that is basically just pure sugar. They've got your jam here for your toast that is pure sugar. If you look at the glycemic indexes, these are just ridiculous. And probably cornflakes here, which, if you have any common sense, all of these are terrible. And all of this here, you might as well just eat syrup, is basically what this is saying. Now, I am a big advocate of different diets, and I'm going to make a more in-depth video about what diet you should specifically do. And the Mediterranean diet is definitely what I recommend for a long-term longevity standpoint, but a lot of this is a very accurate food chart of what it should look like. Now, with the whole grains, I definitely recommend that you avoid wheat as much as possible, especially if you get any type of brain fog after, because gluten intolerance is a huge issue. But this review showed that the Mediterranean diet is very successful in helping people manage their diabetes, and it can be very beneficial for their longevity as well. And then with this, diabetes increases the risk of coronary disease, increased risk of stroke, erectile dysfunction, kidney disease, and risk of dementia. And nobody wants erectile dysfunction, right? So with this, it's talking about that once you get around that 126 range for your fasting blood glucose is when you start to have serious risk of cardiovascular disease. And the higher that is, the higher your risk of cardiovascular disease. Now, this is a very interesting study, and it talks about how the gut microbiota in adults with type 2 diabetes differs from non-diabetic adults. And what I find from a clinical standpoint is that Candida albicans is a huge issue when it comes to why people crave sugar. And that can be located on your tongue, but it can also be located in your gut as well. And it makes you crave sugar because that's what it feeds off. It's a bimorphic substance. It's a yeast and a fungus. Go back and watch one of my videos about Candida and see if you can connect and you feel like that's describing you perfectly. But this is very interesting when we talk about overall gut health, and this is why I'm a huge advocate of any type of gut cleansing or gut program. Now, if you're in China, sorry, but air pollution will worsen your insulin resistance because it takes any of your metabolic capacity to detox, and it just clogs down the liver. And we can see that the liver is very important when it comes to blood sugar regulation, gluconeogenesis, and adipolysis. But the more toxins that you place in the body, it's actually going to make your blood sugars worse. Now, there is a study showing that and just how air pollution can cause those issues, especially if you're in the bigger city. This is something to think about. And then toxic metals. There was an increase in diabetes amongst those with high cadmium levels, and then also mercury. And so aluminum and lead linked to elevated fasting blood sugar. So this is very interesting. Not only is it your environmental exposures, but it can be if you have any amalgam fillings, if you do any type of painting, or if you chewed on a lead straw when you were younger, whatever it may be. All of these can really affect you. And it's very important that if you suspect those, you do any type of testing to make sure that you don't have any heavy metals, because those can prevent you from getting well. There's also a 47% higher risk in diabetes with those in the highest levels of urinary BPA. This is found on receipts and all of your plastics that you touch almost every day. So BPA and the risk of cardiometabolic disorders, this was a systematic review talking about how they were measuring these people with diabetes, and they showed that they had high levels of urinary BPA. So they actually had the substance in their urine. So that is something that you can definitely test for, but just be aware of, everything does add up over time. Not only are those environmental toxins, but antibiotic use. And I don't know about you, but I know tons of people that have been on antibiotics. I actually worked in the traditional medical model for a while, and they were saying we need to stop giving people so many antibiotics because these bacteria were getting more and more prevalent and stronger, and they weren't working as well. And this was a really big scare that there was going to be a superbug created. But this study showed that antibiotic use can increase the risk of diabetes mellitus by 53%. So the more you take it, that compounds upon itself. So if you have any type of gut issues, if you're chronically getting infections or sick, look at your immune system. Have somebody take a look at it. They can help you build that up. Get plenty of sunshine, vitamin D, eat some zinc. Do these things that are good for your body instead of just relying on a pill to fix it. And of course, stress. Stress plays a huge part into this. That was another study. And then sleep. So I believe it's 15 to 30% increased risk of diabetes in a nurse health study with sleep duration of 6 hours or less. A lot of our patients aren't getting very good sleep because they're having pain in their feet. And so getting them restful sleep, whether we're using a topical like a NeuroSoothe in order to get the pain out of the feet or the hands, is very important. And typically we can get them back to sleep, getting restful sleep so that they can heal. And this is saying that subjects who reported difficulty initiating sleep or maintaining sleep had 2 to 3 times the risk of developing type 2 diabetes. And that is just so important because sleep is the portion of the day where your body actually resets and heals. And if you're not getting good sleep, there's no way that you're going to heal. So make sure you practice good sleep hygiene. Now, breastfeeding, this is very important for you moms who are maybe watching this, or share this with any of the newly mothers that you know. But breastfeeding longer than 6 months lowers your baby's risk of type 1 diabetes by 50%. So I don't know about you, but I would hope that my mother would be able to breastfeed me for longer than 6 months to help reduce my risk of type 1 diabetes. That would be phenomenal. And it lowers risk of type 2 diabetes by even more, by 76%. And it can also help lower risk of childhood obesity. Now, I wasn't breastfed as a child, and so I did not. I think that at one point I did develop pre-diabetes because of just eating Little Debbie's too much and not getting enough exercise. But with that, I think that I definitely was obese as a child. When I was 12, I weighed 200 pounds. And I don't think a lot of people understand my whole journey, and that's a topic for another discussion. But I think it definitely played into that role. Now, there are 17,000 citations in PubMed, which is the medical research place, of exercise and diabetes mellitus. Just do it. 15 to 30 minutes 3 times a week can greatly reduce your risk for developing diabetes. So get out there, move a little. Now, here's an interesting fact, and I am not a medical doctor, but with this is their advice, not mine. Metformin and glyburide can lead to B12 deficiency, can cause neuropathy, folate deficiency, neuropathy, and ubiquinone interference. So all of these have consequences. No matter whether you're taking a steroid, a antibiotic, whatever it may be, there are always going to be other consequences, but there are no consequences for eating healthy and taking whole natural supplements, okay? Now, berberine and blood sugar, I made a video about this diving in deeper depth, but this was a study that showed reduction in fasting blood sugars for these patients. Their A1Cs were dropping from 7.5 to 6.6, and I'm sorry that those are cut off, but it was showing that their prevalence and their fasting blood glucoses and their non-fasting blood glucoses were dropping in greater percentage as well. So this is why berberine is getting such great attention, and it's being used therapeutically to help people with diabetes. Now, how does berberine work? It activates something called MK, which in the liver increases fatty acid oxidation, ketogenesis, decreases cholesterol synthesis. So if you have high cholesterol, decreases lipogenesis, so the production of fat. And in the pancreatic islets modulates insulin secretion, so it can help with if promote more insulin if your blood sugars are staying too high, or if you're getting hypoglycemic, it can help regulate the insulin secretion by saying not too much. In the skeletal muscle, it increases fatty acid oxidation, increases glucose uptake, so it lowers your blood sugars. And in the adipocytes, decreases lipogenesis, the creation of fat, and it decreases lipolysis, which is basically the reason that that is important is that it's going to decrease your blood sugars as well because it's not going to get released. Now, here are some plant polyphenols reported to activate MK. Resveratrol, quercetin, curcumin, which is turmeric, berberine, theaflavin. I can't say some of these, but otherwise, these top 4 up here are the ones that we use most commonly. Resveratrol is found in like your red wines. I don't recommend that you go and drink a bunch of red wine, but it is something that can be pulled from grapes and red wine. Quercetin is something, I can't remember where that comes from, but we use it in one of our supplements to help lower blood sugars as well. And you can use a combination of all of these, which is great. Now, alpha lipoic acid is getting a lot of attention too because it lowers oxidative stress, protects against free radicals, decreases left ventricular hypertrophy, which is thickening of the heart muscle, improves insulin sensitivity and lowers blood sugar, chelates metals, very important, improved endothelial function, lowers blood pressure, decreased dementia risk, improves the lipid profile, and activates MK and all of these other enzymes that are really good for you. So there's also Moringa powder, which has a lot of medicinal benefits. So you all can read these. I'm just going to leave it here. But if you have any of these issues like gastric ulcers, if you have any type of inflammation, if you have cholesterol issues, a lot of these can be solved by doing, I tell everybody, it's more like baking a cake than it is anything. If I bake a cake and I don't have eggs, the cake's not going to turn out very well. But if I have all the right ingredients, and that's what practitioners can help you with, that's why we're here, guys, and you do it at the right temperature, the right intensity for the right amount of time, you're going to get great results. There's no doubt. Probiotics, another study showing how this can help with diabetes as well. Probiotics and type 2 diabetes therapy, it has been shown to lower A1C as well. And then, oh, that was a double slide. So there you have it, everybody. These tips and tricks throughout this, and go back and watch it if you want to take notes. Comment below if you have any questions because I'm here to help, and I wanted to make this so you all can understand how these things actually work, all the studies behind them, even though they're a little bit older. All of these can help you manage your diabetes. It's very important that you not only support yourself, but support your family members, your friends, to prevent these issues from happening because they are wrecking people's lives and we see it every day. And it's my mission to help as many people as possible. So if you found this video helpful and informative, please like it. That definitely helps my channel out so I can make more videos like this. Share it with your family and friends. And if you need any support or need any help, please let me know. Okay? All right, everybody. I hope you all have a wonderful day and hopefully you like this video. Bye.